All right, so I feel like there's this huge misconception that med school is super duper difficult. And while I feel like it can be, I kind of want to talk about my experience and why it's actually not. And I basically just want to talk to you guys about what medical school is really like, at least coming from my perspective. Of course, other people are going to have different perspectives. This is just mine. So for those of you guys that don't know, of course, medical school is 4 years long. You have to go to college, get some prerequisites in, get a college degree, take an MCAT, which is this huge like 6-hour exam. And you got to apply to a bunch of med schools and then get in. And that whole process is a challenge in and of itself. But then here comes medical school. What everybody thinks is this huge challenge, which it is. But again, different people have different experiences, and I'm just going to talk about mine. So you finally got into medical school. Let's start from year one. So my first year was kind of all over the place, I'm going to be honest. My first month of school, I was probably the biggest gunner in the world. Basically, I just studied 24/7. I stopped going to the gym. I probably slept quite a bit less than I usually did. And then the first exam came around, and I just remember getting my score back, and I got a pretty decent score, and I was happy with it. And then when the scores for the class came out, I realized I got like a top 10 score out of 144 students, and I was pretty dang psyched about that. And then I realized, was studying that much this entire past month even worth it? Yes, I got like a top 10 score, but I put aside sleep, going to the gym, being healthy, eating healthy, all those things that are super important, free time, hobbies, put all that off to the side just for that one exam. And honestly, I realized if I would have just passed that exam, I would have been probably just as happy. So this is where the mentality shifted. So after that exam, I basically just said, screw it. I'm gonna start going to the gym again. I'm gonna start sleeping more. I'm gonna start doing all my things like I usually did. And so that's what I did. Second exam came around, and I think I got just above what the middle of the class got. So still, an average, maybe slightly above average score. And I was just as happy. And I had my sleep, I had my gym time, I had all my hobbies going for me. And that realization was the biggest clutch moment of my entire medical school career. Yeah, I was sacrificing some grades, but the mental health and the physical health started going a lot higher. And when I say I kind of stopped caring as much, it's not that I was not even studying anymore. I'm still studying a lot. You know what I mean? I'm still putting in quite a bit of effort, right? During your first year of med school, your first 2 years actually, you basically have lectures from 8 a.m., 8 in the morning to 5 p.m., Monday through Friday, with some labs spaced in between there. And so no matter what, that's your base minimum. You have to do that. So you're already going, 40 hours a week minimum. So it's not like I wasn't doing anything, you know what I mean? But I feel like after that 8 to 5, I was just studying a little bit after that. I was, going to the gym, getting some more sleep, and life was great. If I had to guesstimate, I was probably putting, 50, 60 hours in a week for my first year of med school, which is like a full-time job, a little bit more than a full-time job, a typical 40-hour weeks, but not significantly worse. And then as the months went on during my first year, I realized I can just stay at home, put these lectures online at 1.5 to 2 times speed, and get through them almost twice as fast, and even have more free time. Because for the first month, inside the classrooms, in person, pretty much all the seats are loaded, right? Everybody's there, everybody's all stressed out. Everybody was like me, trying to get their highest score on that first exam. But then you just see the lecture hall just slowly decreasing in the amount of people actually showing up. And of course, more people are just watching the lectures online. So that was basically year one. I felt good putting in my 50, 60 hours probably per week, studying and / watching lectures / going to labs, and life wasn't bad. I met a lot of great friends. And so now year two comes around, I'm already more at ease, I'm already more relaxed. So I'd say the first half of year two went just about the same as, the latter half of year one. But then at the latter half of year two is kind of when the board exams start trickling in, and you realize you got to start studying for them. And again, these board exams are 8-ish hours long. I don't know how many questions, 400-ish questions, something like that. I can't even remember. I honestly don't even care at this point. But you, of course, got to pass the exam to move on. So it is pretty stressful. And you do end up having a dedicated period to study for that exam. And I remember studying, anywhere from 8 to 12 hours a day for about 4 weeks straight. I didn't take any days off because I didn't study as much during the year as I probably should have for these board exams. So I just turned up during my dedicated period to study for those exams. And this is the one time in my life I actually felt burnt out, and it was not a good feeling. I ended up getting through it, passing my board exams, and life was good again. And then now year three comes around. So now you're going off to these clinical rotation sites, a lot of your year 1 and 2 friends have moved away back to where kind of they're from, or to a different rotation site, so you don't really see your friends anymore. And I personally moved back home to my hometown to work at the hospitals and clinics around my city. So I was back home with family, with my old friends from like undergrad, college, and honestly, life was again pretty good. And it's kind of the same thing there again when third year starts, just like when year 1 started. You're kind of like, oh gosh, I'm gonna be in clinics, I'm gonna be in hospitals, I'm gonna be like actually seeing patients. Oh gosh, I gotta be on my A game. So then like your first rotation comes around, you're like, oh gosh, you know, you're stressed out, you're gonna put in like a ton of effort, and you end up putting like a ton of effort in for like the first rotation or 2, and then you realize that, what am I doing? You know what I mean? You always like just take a step back, like why am I putting in so much effort for something that probably doesn't matter too much if I put in like a lot, not significantly a lot less effort, but a decent amount less effort into, you know what I mean? So instead of putting in 100% effort, why can't I just put in 75% effort when it's pretty much gonna yield me the same results? So again, that's what I did, kind of took a step back. You know, if I missed a couple extra questions that maybe the preceptor that I was working with, the doctor that I was working with asked me, I don't care. I don't care. You know, I'm still learning, I'm still putting in the effort in. You know, I'm still continuously studying for the next round of board exams that are coming through, and I feel like I'm still learning. And basically year 3 was just you show up to the clinic or you show up to the hospital. Sometimes you're just shadowing the doctor, which sucks. But between the patients, you can just have your computer out doing like board exam questions, practice questions, stuff like that. And then on some of these other rotations, the preceptor, the doctor you're working with actually has you see patients yourself, and maybe even write notes on them, and then also discuss the patient, present the patient to the preceptor, to your preceptor. And you know, of course, you're probably learning a lot more that way. But regardless, you know, you're learning a lot on all your rotations because you're actually seeing stuff in person, even if it might just be shadowing. Some preceptors care a lot about you. Some of them don't really care. Some of them just take students just to have an ego boost. I'm not even lying. Some of them just like have you there just to be like, yeah, I'm teaching this guy. Like, yeah, I'm a big shot. Some of them are like that. And then other ones actually really do care about your learning and try to teach you things, try to get you hands-on, stuff like that. So it's just like college, right? It's just like high school. Some teachers are a lot better than others. Some of them actually care about you. Some of them are just there for a paycheck or whatever, you know, it may be. And in a lot of cases, I felt that it was just like an ego boost. Like they just wanted to be like, yeah, I have this student here. What's up? You know, I'm him, which was, all right, you know, okay, man, okay. You know, and as a student, you're just like kissing their toes because you want them to write you a good evaluation at the end of it. And it's kind of a weird dynamic, I'm not gonna lie. So year 3 is basically just that. You're studying for board exams in between patients because the next round of board exams is coming up at the end of your 3rd year. But yeah, I was never burnt out because I started studying early. As soon as my first rotation hit in 3rd year, I was immediately studying between patients, like I said. And then even after the rotation, I would just, you know, I'd do like at least 20 questions a day, every single day. And, you know, the questions are long though. Like, it's not just like 20 simple math questions, you know what I mean, that you'd get in high school. They're like long, board. If you guys have been through med school, you know what I'm talking about. They're like paragraph long. They take a lot of thinking, and then when you get them wrong, which I got a lot of questions wrong, you have to like look at the whole explanation and do a lot more studying on it. So it's 20 questions can take 2 hours, you know, easily, depending of course on how much studying you're doing when you get the question wrong or when you get the question right. I was usually getting them wrong. So I feel like in sum, year 3 is basically just like kissing the preceptor's toes, trying to get good evaluations because you need them for your residency interviews coming up in your 4th year. So 4th year comes along, and this is arguably considered the best year of all 4 years, and it definitely was in my opinion. However, it was just the last 6 months that I felt like were amazing. The first 6 months actually kind of sucked. Probably worse even than 3rd year, or just about the same as 3rd year, because you are doing a bunch of interviews, while at the same time you're also doing away rotations at residency places that you want to go to. These are what are called like sub-Is, sub-internships. So like I said, you'll go to a residency place for a month for a rotation, and you'll be acting kind of like a resident there as a 4th year medical student, and you're kind of seeing if they like you, or they're kind of seeing if they like you, and you're kind of seeing if you like them. And then of course, depending on how much you guys like each other, you're more likely to match at the middle to end of your 4th year. So after that's all said and done though, that's like the first 6 months of your 4th year. As soon as you get your last interview finished with, it's all coasting from there. Because you finished all your away rotations, all your scary ones at the residency places, doing like these kind of like easy rotations. You know, maybe you're doing like dermatology, maybe you're doing like pathology, and I call them easy because it's just like, a lot of the times you're just kind of sitting there, watching them, learning a few things here and there. It's very low stress. Those specialties are known as, you know, fairly chill specialties. So you're not doing like general surgery, you're not doing, you know, crazy stuff like that. And the craziest part about this time is like these doctors that you're with during your last couple months of your 4th year, they know that you're just like, you're matched to residency or you're finished with your interviews and you're gonna match soon. And they're just kind of like, all right, you can go home, you know, after this many hours, you know, we don't really need you here anymore. And during 3rd year, if a preceptor tells you that you can go home, you're usually like, oh no, you know, I'll stay, I'll, you know, try and help you here, I'll try and help you there. But then by that time in your 4th year, you're just like, all right, dude, you said I can go home, I'm going home, like no questions asked. And so that's why that last part of your 4th year is just so good. And then kind of near the last few months of your 4th year, you actually like finished up with most of your credits, at least I was, which means that you don't have to do any more rotations. You're just basically on vacation now. So I had like 3 to 4 months of vacation while I was just waiting to graduate, and life was beautiful. I will say, I personally didn't do any research. I did do quite a bit of volunteering and like community service stuff, but no research. And I probably could have worked a lot harder in that department and some other departments to like boost my application for residency, but I matched into a specialty that you didn't really need a whole lot of research in, and you didn't really need a whole bunch of, you know, super duper high board scores to match into. It's called physical medicine and rehabilitation. It's like a lesser known specialty. You guys might know about it. If you don't, it's basically just like a combination between orthopedics and neurology and getting people to function better. And with that being said, I will say that med school can be as difficult as your specialty that you're matching into needs it to be, if that makes any sense. For example, if you were going into plastic surgery, if you're going into dermatology, if you're going into, what else is competitive, radiology, if you're going into orthopedics, I don't know if I said that already, but like those types of ophthalmology, if you're going into these pretty dang competitive specialties, you're gonna have to work a lot harder than I did. But if you're going into something like primary care, if you're going into something like the specialty I went into, even though it's getting a little more competitive now, if you're going into maybe psychiatry, if you're going to like those types of specialties, you don't have to work as hard as the person trying to get in, of course, plastic surgery. So I think med school can definitely be super difficult or super easy depending on what specialty you're trying to go into. And for me, I was kind of like right in the middle. You know, I wasn't trying to, you know, make med school too difficult or too easy. I was happy being average for sure in med school, which made things really nice because I had some free time. You know, I was able to sleep. I was able to try and eat healthy, although I still didn't really eat that healthy. I was able to go to the gym every single week, you know, my 4 days a week. Never really missed the gym, except during my first month of med school, during that first year. And life wasn't bad, honestly, during med school for me. So like and subscribe if this helped out in some way. I'll see y'all in the next video. Peace.